This is Black Mental Health Matters. I'm Dr. Carryann Williams, and I'm a psychiatrist. And today I wanted to share with you a vintage Black Mental Health Matters episode. It's one of my favorites. And initially, when I thought about doing this, I said, well, maybe I'll just redo this episode and I will kind of republish it. But when I went back and I reviewed it, I realized it's an episode that just can't be duplicated. I'm really happy with the way that I presented everything the very first time. So instead of trying to update it or redo it, I am going to replay it for you. And this episode is about alternative mental health treatments. I cover about 5 of them, and later on I'm going to break out 3 of them into separate clips. But these are treatments that you can add to the existing mental health wellness kind of regimen that you're already receiving. So whether that's therapy, whether that's medications, you can add some of these alternative mental health treatments to that. And this is just for you to think about things that you can do to help yourself, though many of these alternative mental health treatments are things that you may still need a trained person to help you with. They're supplemental, and I think they're pretty exciting. And so I enjoyed doing this episode so much, and I know that you're going to enjoy watching or listening to this wherever you are watching or listening from. So here we go. You know, as a psychiatrist, my primary training is in talk therapy and biological therapies like medication treatment. But frequently, I'm asked the question, what about other kinds of treatments? What about alternative treatments? And there are some. And so that's what I want to talk with you guys about today. Alternative treatments often get a bad rap from certain scientists because in our field, there's a great amount of dependence on what they call evidence-based treatments, which basically means that the treatment you're using has to fit into this neat box where you can do research a certain way, and you have to have a certain amount of research for it to be considered evidence-based. But a lot of alternative treatments don't really fit neatly into that box. Maybe you can't really do a placebo kind of arm to compare it to, or maybe it just won't have the kind of funding that it needs. And so it's very difficult for it to have the robust evidence that things like medications might have. But it doesn't mean that it's not effective. So I want to talk with you about that today because alternative treatments can be very effective. And I'm not going to be able to cover all of the alternate treatments today, but I'm going to highlight some that I feel comfortable recommending to you and that I've spoken with my own patients about in the past. And so there are things that I believe are helpful and things that I recommend. And these are methods that don't necessarily work for every single person. However, they do work for a lot of people. And I do believe in a lot of the alternative methods that I'm going to be talking about today. And the thing that kind of frustrates me as a healthcare provider is that I can see how effective some of these treatments are, but a lot of them are not covered by insurance. Insurance is not covering a lot of these treatments. And so what ends up happening is that if insurance doesn't cover it, then most of us that rely on insurance to cover healthcare treatments end up not having access to it. So there's kind of like this disparity that happens with who gets access and who doesn't. You need to be able to pay out of pocket for some of the things if insurance doesn't cover it. And really what it comes down to is that the insurance model that we have, at least in the US, puts a heavy emphasis on illness rather than health. And they'll often say, well, medications, we can't deny you medications. Medications are kind of the backbone of medical treatment. And then when it comes to mental health, they can say, well, talk therapy is the backbone of mental health treatment. So we have to provide some coverage of that. But then all these other things, they can argue that it is, not mainstream, or that there's not enough evidence, or that it's difficult for them to track cause and effect in terms of telling whether or not it's working. And so when the folks that have access to these alternate treatments are the ones that can pay out of pocket for it, you have a discrepancy and a disparity with who has access. And in particular, if you have an entire group of people who have been oppressed and their wealth building has been suppressed in the United States, automatically they're at a disadvantage for healthcare treatments that require paying out of pocket. Now, some of these things are less expensive and some are more. So I'm going to talk about a variety of things, and some of them are going to be accessible to you as well. But the other thing that it just kind of made me think about is that sometimes even the things that we may not have been able to have for ourselves because of financial resources, we can build up the next generation to be the ones that provide those treatments. They can get those high income skills and actually be the ones to run their own business and provide these alternative treatment methods. So I hope you guys are interested in learning a little bit more about this. I believe that alternative mental health treatments are worth considering, because as much as I've seen medications be life-changing, not everyone responds to medication, and not everybody responds 100% to talk therapy. So whereas I don't say that you should forego talk therapy and medications completely, I would say that you should consider adding one of these alternative treatment methods to enhance your treatment. And these may not be standalone. As I said, they're good adjunct. They're good addition. Now, alternative treatments often focus on promoting relaxation, promoting overall well-being. It also helps to connect the mind with the body, which is something that medications can't do, connect the mind with the body. It also can give you a sense of empowerment over your own mental health, because this is the part of the treatment that you can choose to do or not do. It's very much voluntary. It's something you can seek. In some cases, it's things that you can do on your own at home. So it gives you that feeling of empowerment over your own mental health, and it can help support an overall healthy lifestyle. So let's get into some of these underrated alternative mental health treatments. And I have maybe about 4 or 5 of them. I don't know if I'll get to all of them today, but I will try to get through most of it. And the first underrated alternative mental health treatment is called animal-assisted therapy. Animal-assisted therapy. So in the 1960s, there's a psychologist named Dr. Boris Levinson, and he noticed that when he brought his dog's name was Jingles, when he brought Jingles with him to his child therapy sessions, the sessions were much more productive. He found that the children who were withdrawn, they started opening up. And children who had difficulty communicating, they felt more at ease and they started making more attempts to communicate. And so in 1969, he wrote a book called Pet-Oriented Child Psychotherapy. And I've noticed even prior to the pandemic, the site that I work at, sometimes staff members are allowed to bring their dogs. And I noticed that whenever a client that I was seeing had one of the dogs with them, their engagement in the appointment was in fact greater, and they were more emotionally regulated. And now sometimes it could get a little bit distracting for them, particularly if the child had ADHD, they would kind of start paying too much attention to the dog and not enough to the appointment. So it can backfire a little bit, but that's part of the reason why if you're going to incorporate the use of animals into therapy, it needs to be done mindfully, and it needs to be done with some treatment goals in mind. You can't just add the dog to the therapy session and hope that it goes okay. Animal-assisted therapy is a little bit different than that. Now, Sigmund Freud, you guys know about Freud. Freud also had dogs. He had a dog, and you have to forgive me if I mispronounce this because I don't know much about dogs, but he had a type of dog called a chow chow or a chow, and his name was Yofi. And Yofi would sit in during the therapy sessions. And Freud noticed that when Yofi was there, it reduced tension in the patients. The children would open up more again. And the interesting thing is this dog, Yofi, he could help to sense the mental state of the patients. So if the patient was a little bit kind of more depressed, the dog would actually go up closer to them and provide comfort, maybe allow them to pet him. If the patient was very anxious, Yofi would kind of back up a little bit and kind of step back a little bit, and that would be an indicator of the patient's mental state. He could even sense the time length of the appointment, and when it was starting to come to a close, he would naturally kind of start getting restless and things like that.
So animals are useful in therapy. And in particular, it's helpful to note that animal-assisted therapy is not the same thing as having a therapy dog. Okay, animal-assisted therapy is not the same thing as having a therapy dog, and it's not the same thing as having an emotional support animal. It is a special category of therapy that includes specific treatment goals, that includes the care of the animal and a connection to the animal. And most commonly, dogs are probably the most commonly used animal. So you'll hear me kind of use interchangeably the word animal and the word dogs because dogs are the most common one. So dogs have been used in mental health facilities and in hospitals. Having a dog present can create a feeling of normalcy for folks that are in an environment that can feel just so abnormal. They see a dog and it just feels like the one thing that makes sense. It feels normal in that environment. It can also trigger happy memories. It distracts people away from the negative things they might be thinking or experiencing, gives them something else to focus on. And for older folks, bringing dogs into nursing homes and assisted living facilities, it can help to increase their physical activity because now they're interacting with this animal or with this dog. It can also help to keep these older citizens kind of grounded in the present and like oriented to the present, particularly if they're struggling with dementia. It can reduce agitated behaviors in people with dementia because it's kind of regulating and calming for folks. And it just makes them feel happier and less lonely. So having an animal, particularly a dog, present is an underrated intervention in mental health. Animals can provide a sense of calm, a sense of safety. People tend to just feel safer when they're with an animal. Anyone who has a dog will tell you that they sometimes feel safer if they go walking with their dog versus if they go walking by themselves. It can provide a feeling of comfort as well. And it can divert attention away from a stressful situation. It can be helpful for people that have autism for a lot of reasons, people that have depression, people that have schizophrenia, and people that have substance use or addictions can also benefit from animal-assisted therapy. And children that have behavioral problems will also benefit from having a animal-assisted therapy as well. In fact, there's some prisons, I don't know if it's in the US, it might be in the UK, but there are some prisons that use therapy dogs. You know, that's different from animal-assisted therapy. These are just therapy dogs. But they bring therapy dogs in this attempt to reduce violence and antisocial behaviors and even suicide. It can reduce suicide and promote future social reintegration. So I think that was a project that they had been working on using therapy dogs. And the use of animals can also be helpful for folks that are in hospice, kind of end of life issues. Having an animal present can be really useful. So here's the thing is that developing a bond with an animal can help to promote a better sense of self-worth, and it can promote trust. It can promote trust for other people. It can help to stabilize your emotions. It can lower your blood pressure, and it can help you to be more patient, because you have to slow down and be patient to work with this animal or this dog. For children that have autism, it can facilitate the development of social skills and what they call nonverbal communication. Okay, so it can improve their ability to be able to read nonverbal cues, behavioral communication. It helps them to build perspective-taking skills. So now they can try to imagine what that dog might be needing or think, kind of feeling or experiencing. They have to be in tune with what's going on. And that helps to promote empathy. It promotes the development of empathy, and it promotes the ability to nurture something, which is just such a useful thing to develop in children. Now, often animal-assisted therapies will include taking care of the animal. So it will include things like feeding and grooming and bathing, right? So particularly, probably second to dogs, horses are probably the next most common animal used in animal-assisted therapies. So horses, they would have them kind of spend a lot of time grooming the horses and walking with them. It's called equine therapy. Equine therapy, and that equine therapy has a lot of research to back it up, by the way. So if you have a child with a mental health issue and you have the means to pay out of pocket for it, you should consider equine therapy. And it's available right now, even during the pandemic, because it's outdoors. And so some of the kids that I treat really benefit from it. It's something that I would recommend for people that have the means to pay for it. So with animal-assisted therapies, sometimes you go to the place where the animal is, like if you go to the horse, I don't know, what is it, barns or stables or whatever, and that would be equine therapy. Or sometimes they bring the animal to you, like when they bring the dog to the hospital or the mental health center. So, of course, if you are afraid of animals, this might not be the type of treatment that you're looking for. But if you have a child and maybe they are just not used to being around animals, they can acclimate to it. So they can still benefit from this. And for those of you out there that like working with animals and are interested in therapy, you may consider becoming a therapist in this area of animal-assisted therapy. So let me know if any of you guys out there have noticed the benefit of having an animal in your life for your own mental health. For those of you that have maybe had animal-assisted therapy of some kind or have had a therapy dog or emotional support animal, I'd be curious to hear your thoughts. The second thing that I'm going to talk about as an alternative mental health treatment is biofeedback. Biofeedback. So biofeedback is basically where you provide the means to give a person knowledge of what their body is doing, particularly the things that they otherwise might not be aware of. So for example, you might be walking around, you're not aware of your heart rate all the time, but you can use a device which can help you to gain awareness of what your heart rate is. And you can use that information to then take some action to do some relaxation exercises or something like that. So with biofeedback, you get the feedback, and the feedback is basically the information about what your body's doing biologically, and then you can take action to help yourself to relieve stress or to reduce anxiety. And this is important because the knowledge of what's going on inside your body, when you become aware of it, it's helping you to connect your mind to your body. And as I said, that's something medications can't do for you, is that mind-body connection. And biofeedback does that really well. And there are a lot of different kinds of biofeedback. I'm going to go through them. But think about something like trauma. When somebody has experienced trauma, trauma causes a really big disconnect from the mind and the body. The mind and the body is disconnected. And so if you engage in something like biofeedback, you can help to regain that connection between your mind and your body, which can be really helpful in trauma. And when you are able to gain some control over, what your heart rate is doing or what your muscle tension and things like that, you can actually reduce headaches. If you know when to relax your muscles, you can reduce headaches, you can reduce pain, like in fibromyalgia. So biofeedback is good for that. You can reduce anxiety, you can reduce feelings of stress. And there, as I said, there's a few different kinds of biofeedback. And so the first one, the most common form of biofeedback, which you may not, I don't think we even think of it as biofeedback, but it actually is biofeedback. And that is breathing. Paying attention to your breathing is the simplest and probably most common forms of biofeedback that we do, is paying attention to our breathing. And the way to make it a little bit more, I guess, scientific is to use sensors. You can actually have, with a practitioner, they can put these bands around your chest and your abdomen, and it can give you more specific information about your breathing patterns. And you can work with this therapist, and they will guide you through what to do with that information about your breathing patterns. So a lot of people don't realize that when we're anxious, we actually breathe faster and we take more shallow breaths. So the whole point of trying to regulate your breathing is helping to train yourself to take deeper breaths. And when you do that, it actually triggers changes in your body that causes you to relax. It reduces your anxiety. It reduces your stress. So it sends this message to your nervous system. The second type of biofeedback is for your heart rate, and it's called heart rate variability biofeedback. And so, of course, with this, you're going to place a sensor on your body, like your wrist or your chest, and you're going to get feedback about your heart rate. That may be the actual number. A therapist can tell you what the parameter is for the cutoff, or that might be just a beeping sound when it goes over the a parameter. It just maybe it beeps or something, tells you when your heart is beating really fast. And that is usually indicative of somebody being stressed or anxious when their heart is beating very fast. So when you get that signal, you get that feedback, now you can actually do some kind of exercise or meditation or something that will help you to relax and get your heart rate back down. So again, you're taking control over your stress levels. The third type, which I thought was kind of interesting, is called the galvanic skin response, the galvanic skin response. And this one measures the amount of sweat on the surface of your skin. It's called skin conductance. And so here's the principle of it, is that when you're emotional or stressed, you start to sweat. And it's not so much that you feel sweaty, but it is enough to where a sensor can pick it up. So it's kind of cool because this sensor will be able to tell that you're getting stressed before you can even really sense a change in your own emotions. So you can pick it up pretty early and do something about it before it kind of gets too far. The next one is about blood pressure. Now, there is a biofeedback device that can measure blood pressure. There is some debate about whether or not it can really help with blood pressure, but the principle is that it can sense when your blood pressure is rising. So it's a device that can guide you through a relaxation technique like breathing, exercise, or music when you can feel that your blood pressure is rising. And then there's skin temperature, which I had not heard of before for a biofeedback device. And the interesting thing, so the theory with the skin temperature one is that your skin temperature actually drops when you're stressed. So it's kind of a little bit, maybe in some ways, what we might not expect, it your skin temperature actually drops when you're stressed. But it makes sense because whenever your body is activated, you will tend to shunt blood towards your vital organs and away from your extremities, right? Because it's like a survival instinct when we're stressed. It activates a survival response in our body. So it's going to shunt blood towards our vital organs and away from our extremities. So it makes sense that your skin temperature, is going to drop. And that's probably why, too, that when people engage in like a relaxation exercise, they often start to get a feeling of warmth. When they start to relax, they start to feel warm. I think it's because that blood kind of flow is kind of starting to normalize a bit. So with this device, it can sense when your temperature is dropping, and that's a sign of physiological stress. And now the next one is the one I'm most excited about, and I recommend all the time, and it's called neurofeedback. Neurofeedback. It is a type of biofeedback that uses brain waves. Okay, now stay with me on this one. It uses brain waves. It sounds a little bit sci-fi, but it really works. And so basically the brain waves are measured using an EEG, an electroencephalogram, much in the same way that if you went to see like a neurologist and they were checking you for seizures or something, they would be using this machine to check your brain waves. So you do need to attach these sensors, which are called EEG leads. You attach them to your scalp. I guess you have to work with a practitioner. The practitioner knows where to place the EEG leads on your scalp, and it puts the information into a computer, and the practitioner can see your brain waves, and they can compare your brain waves to the kind of the standardized brain waves, and they can tell if there's something that's different that's maybe causing you to have difficulty focusing, or to be emotionally dysregulated, or this, that, or the other. They can compare what your brain waves are doing compared to other people's brain waves. And again, it's pretty sci-fi and kind of ingenious, but just kind of, it is an evidence-based treatment. It is something that has definite evidence to back it up. And so here's where the feedback comes in, because, for all these other things, it's like heart rate and blood pressure and all this other thing. How can you get feedback about your brain waves, you might ask? the way that it does is so it takes the information, it puts it in the computer. The practitioner is actually looking at the waves because they're trained to do that. But what you're looking at is something that looks a little bit like a kind of a video game kind of thing, where you might see differences in lighting or in the volume of sound. And that's how you get the feedback about what your brainwaves are doing, is through sound and imagery. So it's given to you in a format that makes sense to you. And by that kind of video game-like experience, you can actually help to train your brainwaves to be kind of back to what they should be. The great thing about neurofeedback, one of the reasons I like it, is that the effects of neurofeedback are enduring. So it lasts beyond the time that you're actually doing it. Most of these other biofeedback strategies, sometimes they're working for the time that you're doing it, and it can teach your body it can teach you how to kind of be more aware of your body. Neurofeedback is literally like brain training. So you can use it for autism, you can use it for ADHD, PTSD, depression, and it can help you to reduce your reliance on medications. You can actually end up using less medications after engaging in neurofeedback for a long time, and the effects don't wear off. They remain. So it's something that I recommend all the time. The issue, though, is that it is expensive. You do have to pay somebody to do this with you. That person does have to charge you some money because they also have to get supervision. They have to buy expensive equipment. But if you are able to invest in neurofeedback, it is definitely something that I recommend. And then the last kind of biofeedback I'm going to talk about is just, muscle tension. So if you have a lot of muscle tension, you might think about doing the type of biofeedback that targets muscle tension. And that is where they place sensors on your actual muscles. They connect it to what they call an EMG, or an electromyography device. And that will detect slight changes in your muscle tension. So that increases your awareness of your internal state, helps you to connect your mind to your body. So biofeedback in general, in all its forms, is highly recommended for people that have chronic stress. It gives you greater awareness about what's happening in your body. It gives you the opportunity to do something earlier about it rather than too late. And it teaches you how to recognize when you're stressed and anxious. It gives you, it kind of increases your body awareness, which is very, very valuable because, as I said, emotions are not just in the brain, they're held in the body. And when you're in a therapy session, the practitioner or the therapist will guide you through strategies to use in response to the information that these devices will give you. So I'm curious to know if any of you guys out there have used some kind of biofeedback strategy, whether it is heart rate or breathing or some of these other things. Now, according to the internet, a biofeedback session could be anywhere from $35 per session to $85 per session. And I'm willing to bet that then is dependent on the level of experience of the practitioner, but also the geographical region they live in. Because, here in the Northeast, services tend to be more expensive than in other places because the cost of living here is more expensive and everything is just more expensive here. So it might be geographically bound, but also based on the experience of the practitioner. And it probably also depends on whether the type of biofeedback is a highly specialized thing like neurofeedback versus just checking heart rate variability, whether it includes built-in supervision. So now this person has to pay another person to supervise them. So there's kind of all these hidden costs that can drive up the cost per session of some of these things. So really kind of thinking about that. And then there's certain things that can be purchased online. So for those of you that like helping yourself, there's some devices that can be purchased online. So for example, if you are interested in neurofeedback, but you don't want to pay, $85 a session, to week by week, you may consider getting a headset that's called the Muse headset. Muse. It's available on Amazon. It's available on its own website, Choose Muse. They retail for around $200 to $300, which is pricey. But if you do a cost comparison, one-time purchase of $300 for the headset versus a weekly cost of $85 for the sessions, then it may be, that you could get the headset. The headset does use the neurofeedback technology, but it's more, I think, geared towards helping you with chronic stress and anxiety and relaxation. But it's, of course, not going to be like working with a practitioner that has specific goals for ADHD and autism and things like that. So you can consider getting the headset. There are a lot of other things like that where you can get a device online that you can do something to help yourself at home. I think there's even phone apps that might help you keep track of your breathing and your heart rate. So I think biofeedback is an underrated kind of alternative mental health treatment. And I do think about it a lot because I work a lot with people that have trauma, and medications are helpful, but they can't address the trauma that you hold in your body, and biofeedback strategies can. So the third thing that I'm going to talk about today is aromatherapy. Aromatherapy. Now, how many of you out there enjoy a good fragrance? I know there's some guys out there that really like great smelling colognes. There's some ladies out there that love to burn candles, and they like to have their kind of tropical smelling hair products. And aromas create an experience for us, and it does influence our mood. People who do marketing, they know this. There are people out there whose job it is to study the impact of fragrances on human psychology and on our mood and behavior. I remember there was even a Netflix documentary that I watched, I don't know, maybe in the last couple of years. I don't remember the name of it, but it was all about fragrances and scents. And I remember there was a scene in this documentary where these two ladies were sitting with an old woman. This old woman presumably had dementia, and she wasn't really able to talk anymore. And these ladies were trying these different fragrances with her. And when they gave her one of the scents, she smelled it, and she immediately started crying. She just broke down crying. But of course, she couldn't talk, so she couldn't explain why she was crying. But it was this powerful moment where even when the mind forgets, the senses still remember. And that's the power of aromatherapy. That's one of the reasons I included aromatherapy as a reasonable kind of addition to your mental health treatment. It may seem kind of kooky, I know, but it's not a small thing. What the mind forgets, the body remembers. And aromas can actually change our mood. Now, aromatherapy is the use of essential oils to enhance your mood or your overall health. You can use them individually, or you can combine them together. You can put it in a bath. You can add it to a carrier oil and massage it into your skin. You can just diffuse the fragrance into the room. And there are a lot of people that sell, things like that, fragrance diffusers. There's a reason why it's an entire industry, okay? Now, of course, aromatherapy is definitely not a standalone solution to most mental health conditions, particularly if it's moderate to severe. It's always just an addition. It's just an added boost. Okay, so always just want to put that in perspective. And here's the way I think about it, right? Okay, so our sense of smell comes from the part of the nervous system that's called the olfactory system. The olfactory system. The nerves of the olfactory system, so it's coming from our nose into the olfactory system. That part of the nervous system directly connects with a part of the brain called the limbic system. The limbic system is responsible for processing our emotions and storing emotional memories, okay? So basically, when you smell something and it hits your olfactory system, it goes directly to the part of your brain, the limbic system, that is responsible for processing emotions and storing emotional memories. So this is why it's not really a small thing. Fragrances, it really does stimulate your brain in a way that is nonverbal. And if you think about it, where the olfactory system is located, right? There's just a very thin piece of bone kind of separating it from the outside world. It's probably one of the more vulnerable parts of our body, but it's also a very direct connection to the outside world. So things that we take in through our nose, it's definitely hits the brain really quickly. So fragrances have a power that it's not not a small thing. Again, not a standalone treatment, but definitely I'd say an underrated intervention. And so fragrances can evoke emotions and it can evoke emotional memories, kind of like what I mentioned with that older woman who just started crying after they gave her a particular fragrance to smell. Now, most of the aromatherapy kind of essential oils, most of them will claim to alleviate anxiety and depression. That's primarily what they talk about is anxiety and depression. And so I'm just going to go over like 4 of them. The ones that maybe I've either recommended to people or have read about repeatedly, and so it seems like it's kind of backed up. Probably the most accepted essential oil in psychiatry is lavender. Lavender oil is probably the most commonly accepted essential oil that psychiatrists will talk to patients about. I've spoken to patients about using lavender. And we use it for anxiety reduction and for sleep. Now, I also read that it can help alleviate depression. I've never recommended it for depression, but I have recommended it for sleep and for anxiety, as in addition to other strategies a person might be using for their anxiety. And you can also even like combine the lavender essential oil with a carrier oil, like sweet almond oil, and you can massage it into your skin. But lavender is meant to help people to feel more calm and to fall asleep. And I have had clients and patients who have found it helpful. So lavender is one to think about. The other one I wanted to mention was lemongrass. Lemongrass essential oil. Not everybody likes the smell of lemongrass, but it's also said to help with anxiety and depression. There is one study that showed that it helped to lower blood pressure when it was used as a massage oil, because it had these effects on reducing stress. And in some of the traditional uses, it was said to help with stimulating mental alertness and reducing feelings of fatigue. And I don't know if you guys are familiar with lemongrass, but I had some lemongrass essential oil. It's pretty strong stuff. If you are considering lemongrass, just remember that a little bit goes a long way for its usage in mental health. The next one is peppermint essential oil, and that can help to reduce nausea and headaches, and it can be mentally energizing while causing like a physical relaxation. So it kind of activates and energizes your mind, but it relaxes your body physically. And like a lot of us are familiar with peppermint. That's a very common one. I don't have to convince you on peppermint. I think most people know that it can help with these kinds of things, nausea and headaches and that sort of thing. So the other one I wanted to add, and it was one that I never really thought about, but as I was kind of looking this up, I saw it written in multiple places, and that is bergamot. Bergamot is extracted from the peel of the bergamot orange. So it has this light citrus note and like mild floral scent. And if you guys have ever like had Earl Grey tea, bergamot is kind of this base in Earl Grey tea as well. And the thought is that bergamot can help to alleviate stress by activating chemicals in the brain that regulate mood, things like serotonin and dopamine, and that it can also lower blood pressure and has helped to relieve feelings of fatigue. So again, a lot of these essential oils will kind of claim the similar things: anxiety, depression, fatigue, relief, mental alertness. A lot of it is kind of very similar. Definitely do your reading on your own, see what you'd be interested in. I'd be curious to know if you guys have heard of other essential oils that are good for aromatherapy. Like, have you tried other things? So aromatherapy is a little bit trial and error, because not everybody is going to like the same things. Not everybody's going to appreciate the same fragrances. It is personal. Some aromas will evoke memories, and if you're lucky, it will evoke a happy memory for you or a positive memory. But if you're unlucky, it might evoke an unpleasant memory. And some people will associate a fragrance with the cologne of a loved one, but maybe if you've experienced some kind of trauma, you might have some fragrances that remind you of an abuser, and it makes you feel horrible and very sad and scared. So, Don't feel obligated to use a particular essential oil if it doesn't feel right to you and if it doesn't make you feel calm. So the other thing, guys, if you're planning to add an essential oil to like a carrier oil and apply it to your skin, be careful of like allergies and rashes. Always, kind of test an area before you kind of apply it to your entire body or something. Kind of test out a small area. And so I'm going to talk a little bit about expressive therapies. Expressive therapies. Now, expressive therapies are things like art, music, dance, and I'm not going to talk about music therapy today because in a couple of weeks, guys, I'm going to have a 2-week series on music therapy. I'm going to have some top-level doctoral music therapists come in and talk to you guys. And then also the next week, I'm going to have someone in the Boston area that talks about the services that they offer. So maybe you can have some access to music therapy. So I'm not going to talk about music therapy too much today. However, what I'm going to talk about is art. I'm going to talk about art therapy. Art can be powerful for boosting your mental health. Now, the wonderful thing about expressive art is that it's not about talent at all. It's not even about talent. So you're not really creating something that's necessarily for someone else or that someone else has to purchase, or it doesn't have to even make sense to anybody else. They don't have to care about it. It's for you. Okay. Now, yes, there can be some therapeutic benefit to making art for other people. However, it's completely up to you. The main thing that's therapeutic about art is actually the process of creating the art. That is what is therapeutic, not necessarily so much the final product. So that is it's the working out of your emotions through doing the art. That's the therapeutic thing. Now, if you do art on your own, that can be helpful. But if you work with an art therapist, then your goals can be more specifically tailored, and you can work with someone who's trained to do this, And if you participate in an art therapy group, then you have the added benefit of the social interaction, which can help with depression and loneliness and social connectedness. Art therapy is known to help with so many things. It can help you with grieving losses. So there's a whole branch of art therapy with helping people with grief. It can help people with emotional trauma. It can help people with schizophrenia. You guys know that there's some famous painters that had schizophrenia and other mental health conditions. As I said, the creation of the art helps you to process your feelings without having to use words. It can help you to release feelings that you haven't really been able to express in other ways. And creating art stimulates the release of dopamine. All right, dopamine is the main chemical in our reward center of our brain. It's kind of like dopamine is what makes us feel happy. So art can do that for us. And for children, creating art actually helps them to learn how to like slow down and control their bodies, because often they have to maybe do little crafts or things like that. So they have to slow down, they have to control their impulses, and it helps overall with their behavior like regulation. So art is really great. I'm curious to know if any of you guys have been using art to help you even get through the pandemic. I know I've recently, over the last couple of weeks, started getting some of the paint brushes back out. I'm not an artist. I do art because it's good for my mental health. And I wanted to just specifically talk about art for the use of trauma, guys. Trauma, as I said, trauma is really, for these alternative kind of mental health treatments, trauma is really a good target. I'm sure you guys have heard about this like right brain, left brain kind of thing. The right brain is a bit more creative. The left brain is a little bit more analytical. Some of the effects of trauma are actually like lateralized to the right brain. And that's the more nonverbal and kind of the sensory kind of parts of our brain. So it makes sense that if you want to heal from trauma, you might want to use a therapy that targets that part of the brain, that sensory part of the brain. Now, you still want to do talk therapy. You still want to use both sides of your brain because you want to facilitate that communication between both sides of your brain. But it's great to, in addition to having the talk therapy and the medications, to have a treatment that specifically targets the right brain, that like an expressive therapy like art. And it helps us to heal. And even if you're not struggling with emotional trauma, it still just supports your overall brain health to stimulate the right brain. Now, studies have shown that people with dementia were able to tap into lost memories through creating art, because individuals can still create art. Even if dementia takes away their ability to talk or to function in other ways, they can still do art. And so creating art can be very centering. And people in end-of-life care have been known to like create things like necklaces to give to their families, you know, before they pass away, things like that. So art can be really, really powerful. Now, art, just like all types of expressive therapies, can feel deeply personal. Some people might feel reluctant to engage in art actually because they feel like it's exposing their inner vulnerabilities. So if you don't feel comfortable, you should try other things instead. But if you do feel comfortable, I would say that you should consider supplementing your mainstream therapy with doing artwork. And so for some of you out there, you might actually be interested in becoming an art therapist. If you like art and you like therapy, you might want to consider becoming an art therapist as well. So I wanted to talk about another type of expressive therapy. And it's one that, again, I think is underrated. We don't hear a lot about it, but it's called drama therapy. Drama therapy. So it's an alternate form of therapy that uses the art of theater as a means for emotional expression and therapeutic goals. If you think about it, when you're acting, you get to be someone else, right? So therapy via like drama or theater, it allows you to take on a role where you can work out certain issues and resolve certain unresolved conflicts in a dramatized scenario. So and it kind of on the surface, it sounds like it wouldn't work because you're like, well, how is this going to actually solve my real problems if I'm just pretending? But it actually does work, guys. Drama therapy actually does work. People have found it helpful to work out conflicts, even with relationships. So let's say, for example, you had an argument with your sister, and then before you could resolve that conflict, something happened and your sister passed away. Sometimes doing some kind of a role play or drama therapy can help you play out that scenario of like, what would you say to your sister if she were still alive? Or what would you do if your sister apologized for what she did? And as I said, it may seem as though it wouldn't work because it doesn't change what happened in real life. However, here's what it does. There's this idea of the emotional resolution. So it doesn't change what happened in real life, but sometimes doing the drama therapy can lead to an emotional resolution about what happened. And that emotional resolution can help you to be able to kind of move forward emotionally and to function in your life and kind of come to terms with what happened. And so you're able to kind of say what you wanted to say in a virtual kind of scenario. And it can provide some amount of relief. Nothing can really ever be 100%, but it can help. It can help. It can be supplemental. So in drama therapy, you get to kind of practice doing something that's difficult, or you can get to experience making the changes that you would wish to see in the world. And it can actually promote empathy. So if you want to use drama therapy with kids, it can promote empathy because it promotes perspective taking. You have to imagine how another character might be thinking and feeling and what they would be doing. You have to see a scenario from multiple different angles. So with drama therapy, you actually increase your insight into a problem and you gain insight into how someone else might be thinking or why they might have made the decisions they made. So it can be pretty powerful. You're looking at it with a different lens. So even if you didn't do drama therapy, just being involved in theater in general can be a therapeutic exercise because it gives you a break from just being yourself, you know? It can give you a break from your life for a while. But with drama therapy, it provides more structure and, it gives you kind of, you working with somebody who's a licensed drama therapist and they can give you a prompt that will lead you in a particular direction. So, for example, you can engage in storytelling. I remember listening to this storytelling from a veteran who would travel the country and tell his story about the trauma he experienced in the military. And that was therapeutic for him to do this storytelling exercise. He got to control how his story was told. And that was helpful for him. Some people like doing like puppetry. And it sounds kind of kooky again to do the puppets, but here's the thing with puppetry is that if you're doing the acting through something else, right? It gives you a way of displacing. You're displacing your thoughts and your feelings onto an inanimate object. You're displacing it onto something else. So what that does is it can make thoughts and feelings that are otherwise very intense and difficult to tolerate. If you can displace it onto something else and have them act it out, it can actually make it more tolerable to work through that situation or to talk about it. And it creates what they call psychological distance. So when you project it or displace it onto something else, it gives you psychological distance. So now you can work on it without feeling the emotion as intensely as you would if you didn't displace it. So that's why some people do puppetry. But one of my favorites is improv. I like improv because you have to think fast and you have to kind of do things quickly, and it breaks down the defenses. But also, no matter what you say and do, if you're in an improv group, people have to roll with it. It's kind of this philosophy of yes and. So they have to kind of roll with it and kind of accept what you've put out there. And it can actually kind of include some humor. So, and you can also practice this greater range of, kind of emotions and things like that. So it can be really, really helpful. I support drama therapy. So guys, I, want to encourage you to consider alternative therapies. Still do meds, still do talk therapy, but you can supplement it with some of these other things.
So that's the episode. Have you guys tried any of these alternative mental health treatments for yourself? For example, have you noticed the benefits of having animals in your life? Or for the biofeedback, have you ever tried wearing a Fitbit or Apple Watch or other kind of wearable that gives you some feedback about what's happening in your body? For the aromatherapy, have you ever tried using an essential oil to boost your mood? Or even just notice the benefits of a great and amazing fragrance and how that affects the way that you feel? And what about expressive arts, guys? I mean, with art therapy, you don't even have to be an artist. You just get to use art to express yourself without the pressure of using words. And the process is therapeutic. And then with drama therapy, you get to play things out while maintaining some distance from your emotions, but kind of take on a role. So in the comment section, I want you to tell me which of the 5 alternative mental health treatments would be number 1 for you. Okay? I enjoy you guys so much. Thank you for watching. Thank you for listening. Take care, and I'll see you next time.